By the time your dog shows the first obvious sign of kidney disease, the excessive drinking, the weight loss, the sudden lethargy, up to 75% of functional kidney tissue may already be gone. Pause. Read that again. 3/4. Gone. Before you noticed anything worth worrying about. Size. Kidney disease is one of the most common causes of death in dogs over the age of 5. And it is one of the most consistently missed conditions in routine ownership. Not because owners do not care, but because the kidneys are extraordinarily good at compensating quietly for a very long time. What that means is this: the window for the most impactful intervention, the window where catching this early genuinely changes outcomes, is almost always open before the symptoms you are waiting for ever arrive. Today, I'm going to show you exactly how kidney disease develops in dogs, what your dog's body is doing to hide it from you, the specific signs that appear before the obvious ones, and what you need to ask your veterinarian right now. Regardless of whether your dog seems perfectly fine, stay with me. This one matters. Let me be direct with you before we go further. I am Dr. Amal. I have spent 25 years working with animals, in clinical practices, in farm settings, and in emergency situations. What I share in every video on this channel comes from real veterinary science and clinical experience. But it is education. It is not a diagnosis for your dog. Kidney disease looks different in every animal. Age, breed, underlying conditions, medication history, all of it matters. Please take everything you learn here into a real conversation with your own veterinarian. That is the only place where your dog's specific situation can be properly assessed. This information is meant to make you a more informed, more prepared owner, not to replace professional care. Now, let us get into this. I am Dr. Amal. Over 25 years, I have seen kidney disease present itself in every form imaginable, from the young dog whose condition was caught early through routine blood work, to the older dog whose owner had no idea anything was wrong until the disease was significantly advanced. The difference between those two outcomes is almost always timing. I have also seen what happens when owners are given the right information early enough to act on it. Kidney disease managed well, caught early, supported properly, monitored consistently, can give a dog considerably more quality time than the same disease caught late. That is why this conversation matters. Not to frighten you, to prepare you. There is a meaningful difference between the two. Let us start with the scale of this. Chronic kidney disease, also called chronic renal disease or CKD, is among the most frequently diagnosed serious conditions in dogs. Research indicates it affects a significant portion of the general dog population, with prevalence increasing substantially with age. In dogs over 10 years old, kidney disease becomes one of the leading causes of illness and mortality, and yet most owners I have spoken with over the years had no idea their dog was at risk until they were already sitting in an exam room with concerning blood work results in hand. Here is the misunderstanding that causes this. Most people think kidney disease is something you notice. They expect it to announce itself. Obvious thirst, dramatic weight loss, a dog that is clearly unwell. And those things do happen, but they happen late. They happen after the disease has already done substantial work. The kidneys are not like the liver or the heart in how they signal distress. The liver has enzymes that leak early. The heart changes its rhythm. The kidneys simply continue. They compensate. They reroute. They maintain function using whatever tissue remains healthy, right up until the point where they cannot anymore. Think of it like a workforce. You have 100 workers in a factory. You start losing workers quietly, 5 here, 10 there. The remaining workers pick up the slack. Output stays steady. From the outside, nothing looks wrong, but the workforce is shrinking. And when it finally drops below a critical threshold, things stop getting done. That threshold for kidneys is roughly 25% of functional tissue. Below that point, the body can no longer compensate. The clinical signs appear. That is the moment most owners first realize something is wrong, but the process began long before that moment. Understanding why that happens, the actual biology behind it, changes everything about how you watch your dog. the kidneys have one fundamental job: filter the blood, remove waste products, regulate fluid balance, blood pressure, electrolytes, and the production of a hormone called erythropoietin, which tells the bone marrow to produce red blood cells. When kidney tissue is damaged through infection, toxin exposure, immune-mediated disease, genetics, or simply age-related degeneration, the remaining healthy tissue does something remarkable. It hypertrophies. It enlarges and works harder to compensate for the lost units around it. Those filtering units are called nephrons. Each kidney contains hundreds of thousands of them. You are born with all the nephrons you will ever have. They do not regenerate. When a nephron is lost, it is gone permanently. What the remaining nephrons do in response to that loss is increase their individual filtration rate. They essentially work overtime. This is called compensatory hypertrophy. And it is the biological reason that kidney disease can be so advanced before any clinical sign appears. Here is the clinical reality that follows from this. The standard blood markers used to screen for kidney function, creatinine and BUN, which stands for blood urea nitrogen, do not typically rise into abnormal ranges until that 75% threshold has been crossed. This is well established in veterinary nephrology. There is, however, a newer and more sensitive marker now available in veterinary testing. SDMA, symmetric dimethylarginine, is a blood marker that research indicates can detect significant kidney function loss earlier than traditional creatinine testing. Some studies suggest SDMA may flag changes when as little as 40% of kidney function has been lost, rather than 75%. That is a meaningful difference in early detection window. It is worth asking your veterinarian whether SDMA is included in your dog's wellness panel if you have not already. In about 2 minutes, I am going to walk you through the observable signs, the ones that appear in that earlier window that most owners explain away or do not connect to kidney function at all. Kidney disease in dogs is formally staged using the IRIS system, the International Renal Interest Society staging guidelines. Most veterinary internists and nephrologists use this framework. It runs from stage 1 through stage 4, with stage 1 being the earliest and most compensated, and stage 4 representing the most severe compromise of kidney function. What I want to give you here are the observable signs that correspond to those stages, in language you can actually use at home. This is the most consistently reported early sign. Not dramatic gulping at the water bowl, a dog that needs to go outside more frequently than usual, a dog that wakes you up at night when they never did before, a dog whose water bowl empties faster over the course of a week. These changes are easy to attribute to heat, activity, or diet. They are worth tracking rather than assuming. Not a dog that refuses food entirely, a dog that approaches the bowl with less enthusiasm than usual, eats more slowly, occasionally leaves food behind that they would normally finish, appetite changes that come and go over weeks rather than days. Not a dramatic drop, a dog that feels slightly less substantial when you run your hands along their rib cage compared to 6 months ago. Gradual, easy to miss without a consistent reference point. Waste products that the kidneys are not filtering efficiently begin to accumulate in the bloodstream. This is called uremia. One of its early manifestations can be nausea, particularly on an empty stomach in the morning. A dog that vomits occasionally and seems otherwise fine is not always just having an off day. A coat that has become duller, drier, or less dense than it used to be without a dietary explanation can sometimes indicate that the body is redirecting resources away from non-essential functions. When this becomes impossible to attribute to anything environmental or dietary, when your dog is drinking visibly and constantly, this is not a watch and wait situation. When ribs that were previously difficult to feel become easily palpable within a short period, prompt veterinary evaluation is warranted. Either alone may be benign. Both together, persisting beyond 48 hours, should be evaluated. This is a sign of significant uremia, waste product accumulation, and represents advanced disease. This is not an early sign. If you are seeing this, the situation requires prompt attention. The most common mistake is straightforward. Owners wait for the dramatic sign before they act. They see the subtle increase in water intake and think, hot weather, more exercise, different food. They notice the slightly slower appetite and think, picky phase. They observe the occasional morning vomit and think, ate too fast, grass yesterday. Each individual explanation is plausible. The problem is when multiple subtle changes appear in the same dog over the same period, and each one gets its own benign explanation rather than being considered as a pattern. Dogs with early kidney disease often present with 2 or 3 of these subtle signs simultaneously, and owners arrive at the vet only when a 4th or 5th sign finally breaks through the threshold of concern. The second mistake, and this one genuinely surprises people, is assuming that a normal vet visit 6 months ago means the kidneys are fine today. Kidney disease can progress in meaningful intervals. A dog whose blood work was unremarkable in the autumn may have crossed a significant threshold by spring. This is especially true in older dogs. Annual wellness checks are a minimum. Semi-annual blood work in dogs over 8 is something worth discussing with your veterinarian. The third mistake is assuming certain breeds are not at risk. While some breeds do carry higher genetic predisposition, Bull Terriers, Cocker Spaniels, German Shepherds, and Samoyeds among them, chronic kidney disease can develop in any dog of any breed. Breed is a risk factor. It is not a protection. Most owners do not know these things. That is not their fault, but now you do. Here is what you can act on, starting now. For 3 days this week, fill your dog's water bowl to the same level each morning and check how much is gone by evening. Do this consistently for 1 week. Write the numbers down. Normal water intake for a dog is approximately 50 to 60 milliliters per kilogram of body weight per day. If your dog is consistently exceeding that, note it and bring it to your vet. You cannot monitor change without a reference point. Most veterinary clinics will let you use their scale for free between appointments. A consistent monthly weight gives you the most sensitive early indicator of gradual weight loss, the kind that is invisible without a number. A loss of more than 5 to 7% of body weight over 3 months without a dietary change warrants investigation. Ask your veterinarian whether SDMA is included in your dog's current blood panel. If it is not, ask whether adding it makes sense given your dog's age and breed. This is not an expensive add-on in most practices, and it represents a meaningful improvement in early detection sensitivity over traditional kidney markers alone. Dry kibble contains approximately 10% moisture. A dog's natural prey diet contains approximately 70% moisture. Chronically low water intake from dry food-only diets is a known contributing factor in kidney health. Adding wet food to even 1 meal per day, or adding water or low-sodium broth to dry food meaningfully increases daily fluid intake. Discuss any dietary changes with your veterinarian first. From today, note any vomiting episodes with dates, any changes in appetite, any changes in urination frequency or nighttime waking. Not obsessively, just accurately. 3 entries over 3 weeks that form a pattern is something your veterinarian can work with. He has seemed a bit off lately is not. Annual blood work is the standard recommendation. For dogs in their senior years, 8 and above depending on breed size, twice yearly is increasingly recommended by veterinary internal medicine specialists. A 6-month interval can catch progression that annual testing would miss entirely. This is a conversation worth initiating with your vet directly. Here is what I need you to take away from today. Kidney disease affects a significant portion of the dog population and is one of the leading causes of death in older dogs. Its most important characteristic, the one that makes it so consistently dangerous, is that it progresses silently. The kidneys compensate using remaining healthy tissue until that compensation is no longer possible. By the time the classic signs appear, the disease is typically well established. The early signs, subtle increases in thirst and urination, mild and intermittent appetite changes, very gradual weight loss, occasional morning vomiting, are real and observable. They are simply easy to explain away individually. The habit of noticing and tracking change rather than explaining it away is your most powerful tool here. SDMA testing, semi-annual blood work in senior dogs, consistent weight monitoring, and adequate daily hydration are the practical levers available to you right now before anything is wrong. Use them. And please, bring this conversation to your veterinarian. That is where your dog's specific situation gets the assessment it deserves. Before you go, one question I want you to answer in the comments. When did your dog last have blood work done? And did that panel include a kidney function screen? Just tell me how long ago. No judgment. I want to know where most dog owners are actually starting from. Leave your answer below. Next week on Paw MD, chronic ear infections in dogs. Not the surface conversation, why they keep coming back after treatment, what is actually driving the cycle, and the question most owners never think to ask their vet that changes the entire approach to managing them. If your dog has had more than one ear infection, that video is going to matter. If today gave you something useful, something you will bring into your next veterinary conversation, subscribe to Paw MD. Hit the bell. Every week we have exactly this kind of conversation. I am Dr. Amal. Look after your animals. They are counting on you.